Nasal congestion is a common symptom among older adults, yet few realize how significantly it can affect their health and overall quality of life. What seems like a minor issue can lead to serious consequences, especially when it causes sleep disturbances. Sleep is not merely a physical rest. It is a vital time for the body to regenerate, repair, and recover. For the elderly, this process becomes even more essential. Without deep, restorative sleep, the body cannot function optimally, leading to complications such as memory decline, chronic fatigue, and increased risk of serious conditions like diabetes, high blood pressure, and even stroke. Sleep is crucial for the elderly, not just as rest, but as a foundation for healing and renewal. However, nasal congestion can turn sleep into a nightly struggle. When the nose is blocked, breathing through the nose becomes difficult, forcing seniors to breathe through the mouth. This method of breathing is less effective in delivering oxygen and often results in dry mouth, discomfort, and potential complications such as snoring, sleep apnea, or complete insomnia. These disturbances not only impair sleep quality, but also compromise cardiovascular health, particularly in those with a history of heart conditions or hypertension. Prolonged sleep deprivation due to nasal congestion doesn't just lead to fatigue, it deeply affects mental and emotional well-being. Without adequate sleep, the body cannot heal and cognitive function declines. Seniors often experience irritability, impatience, and in many cases, symptoms of anxiety or depression. Research shows that sleep-deprived older adults are at a higher risk of developing mental health disorders compared to those who get sufficient rest. Worse, chronic sleep loss may accelerate cognitive decline, increase confusion, and exacerbate symptoms of Alzheimer's or other memory-related conditions, adding emotional strain on both the elderly and their families. In addition, sleep deprivation weakens the immune system, making seniors more susceptible to colds, infections, and chronic illnesses. Those with already weakened immune systems frequently experience recurrent infections or long-term conditions such as cardiovascular disease, diabetes, and cancer. Continuous nasal congestion, if left untreated, only prolongs discomfort and compounds the risk of sleep loss. Without sufficient rest, the body cannot regenerate cells or repair daily damage, slowing recovery and making older adults more vulnerable to serious health complications. That's why early identification of nasal congestion and its underlying causes is essential. The issue may stem from respiratory problems such as sinusitis, allergic rhinitis, or sleep apnea. Environmental factors like dry air, temperature changes, air conditioning, or exposure to cigarette smoke can also aggravate the condition. Seniors with their lowered immune defenses are especially sensitive to bacteria, viruses, and airborne allergens, making nasal congestion a persistent and hard-to-treat problem. However, nasal congestion and sleep difficulties can be managed effectively. A combination of daily habit changes and natural remedies can make a big difference. One simple yet effective method is rinsing the nasal passages with saline solution. This helps flush out dust, bacteria, and mucus, clearing the sinuses and improving airflow. Herbal steam inhalation with eucalyptus, peppermint, ginger, or perilla leaves can also help soothe the nasal lining and reduce congestion. Over-the-counter nasal sprays and decongestants may also offer short-term relief. Equally important is adjusting daily habits to improve sleep quality. Seniors should avoid caffeine, alcohol, or stimulants before bedtime, as these can interfere with sleep and worsen congestion. Gentle physical activities like walking, yoga, or meditation can help relax the body and mind, making it easier to fall asleep. Maintaining proper humidity in the bedroom with a humidifier if necessary can ease nasal dryness and make breathing more comfortable, especially in the winter months. Furthermore, a balanced diet plays a critical role in supporting nasal health and promoting better sleep. Foods rich in vitamin C, zinc, and magnesium such as oranges, kiwis, leafy greens, and nuts help boost immunity, reduce inflammation, and support healthy respiratory function. While these methods may bring relief, persistent or severe nasal congestion should not be ignored. Seniors should seek medical attention if symptoms persist, as this may signal underlying conditions such as chronic sinusitis, nasal polyps, or long-term allergic rhinitis, which require professional treatment. In conclusion, sleep is not just a basic human need. It is essential to living well, particularly in old age. When we prioritize sleep health for our elderly loved ones, we are not just helping them rest, we are giving them the chance to live longer, healthier, and more joyful lives in their golden years.